Radio Doctor is Nigeria's first specialized radio health program on WFM 91.7, broadcast 10 a.m. Monday through Saturdays. Each day is dedicated to a medical specialty with an expert to offer consultation and advice. My name is Mojisola Talks. On Radio Doctor today, we will be discussing gastrointestinal diseases, causes, and treatment. With me, and I have over the phone Dr. Abiola Ajayi, the MD CEO, ROA Specialist Hospital. Good morning, doctor.
Good morning.
How's been your day?
Wonderful. Thanks for having me.
No, you're welcome. Okay, doctor, let's get to the brass tack like almost immediately. Okay, I'm sure someone listening over their radio might be like, okay, so what's this gastrointestinal disease? Can you help us define it?
Yes, we're talking about gastrointestinal diseases. We'll first talk about what is the gastrointestinal tract. And the gastrointestinal tract is from your mouth all the way down to your anus. Everything in between is the gastrointestinal tract. So that's your mouth, your esophagus, your stomach, your small and large intestines, and then finally your rectum. So any disease affecting that area is what we call a gastrointestinal disease.
Thank you very much, doctor. So what are the common types of gastrointestinal diseases we have?
The most common ones are things like constipation, which we should all be aware of. Diarrhea is the opposite. And then in between, you have things like reflux or heartburn, and then things that can cause nausea and vomiting, as well as gas. So, if people are listening now, we know that we've all experienced some symptoms, some of these symptoms before. Some of them are normal occurrence, and some of them, for example, rectal pain and rectal bleeding, which can also be symptoms of gastrointestinal disease.
Okay, thank you very much, doctor. Can we now state the causes of gastrointestinal diseases?
Yeah, well, you have for each of the different diseases, of course, you have different causes. For example, constipation, we know that a lot of that can be caused by or low amount of water in your diet. And then you have other things, other diseases such as IBS, which is irritable bowel syndrome, as well as hemorrhoids that they call piles here in Nigeria. Locally, we all think piles or hemorrhoids are caused by too much sugar, but really it's caused by your diet being inadequate, especially sugar. So most of the gastrointestinal diseases may have causes that are lifestyle related. What we mean by lifestyle related is what you do, maybe eating too much spicy foods, not eating the balanced diet. And then some of them can be genetic, like irritable bowel syndrome.
Okay, thank you very much, doctor. It's 7 minutes past 10, and with me over the phone is Dr. Abiola Ajayi, the MBCEO ROA Specialist Hospital. And what we're talking about is gastrointestinal diseases, their causes, and their treatment. The doctor has already defined it for us. He has told us the types that we have and has also told us the causes. And now is the time that you can join into the conversation by calling in on 07000 917 917 or just text us on 070 317 56537. Okay, doctor, can we now talk about the symptoms?
Yes, we can. We have, for example, I'll keep repeating it. When we're talking about gastrointestinal diseases or GI diseases, we have so many of them, a wide range of them. We also have a wide range of symptoms. For example, some of them, constipation can be a symptom, meaning not stooling often enough, just like running loose stools can be a symptom. And one of the diseases we talked about here actually has alternating. The person will have constipation, alternating with diarrhea, back to constipation. So the history from the patient is extremely important. So we can now put the patient in one of these categories. We talk about functional gastrointestinal diseases and structural gastrointestinal diseases. I'm not trying to make the listening public. I'm not trying to turn them into the main reason the main way we differentiate them. Does your GI tract look normal, and does it function normal, or does it look abnormal and function abnormally? That's the difference between structural and functional disease.
Thank you very much, doctor. So, are there habits that one can adopt to avoid these diseases?
Yeah, there are a lot. The most simple, increasing your the amount of fiber you have, especially if when we talk about constipation for the average person, that's stooling less than 3 times a week, 3 times or less. So you have something like that. The easiest thing you can do is add fiber and add water to your diet, and that's not just for constipation. It's good to do that regularly. And when we talk about fiber, we talk about things that can help you move your bowels. So in Nigeria here, we have lots of fruits, we have lots of vegetables. All of those count as fiber.
Okay, I've been speaking with Dr. Abiola Ajayi of the MDCEO of ROA Specialist Hospital, and you can reach him on 09135795108. But before you do that, or in case you want to do that, you can still call in to ask any question you want to from him, and he will definitely answer you. This is Radio Doctor. We are real doctors advise real people. The number to call is 07000 917 or just text and send us a WhatsApp message on 070 56537. We've been discussing gastrointestinal diseases, the causes and treatment. Thus far, doctor has defined it, what gastrointestinal diseases are, and you had mentioned constipation and all. He has told us the common types and told us the causes and the symptoms too. Also, he has told us habits that we can adopt to avoid these diseases. So, doctor, how can these diseases be treated?
Yes, we have many treatments. The treatments are specific to the disease. I'll keep using the classic examples. If we have constipation, we try to add fiber and things to the diet. Before we talk about treatment, though, we have to talk about diagnosis. How do you
Diagnose it.
gastrointestinal disease? Yes, then we can now talk about how we treat it. So when we have something that's functional, meaning your gastrointestinal tract looks normal but is not functioning normal, at times we may have to do blood tests, or if you're having bleeding and or other issues, we may have to do a biopsy. That's where we put a camera in either your stomach and either your mouth and go down towards the stomach, or sometimes we take a camera from the rectum and go up towards the stomach, looking for different causes of GI problems. For example, you can have ulcers, bleeding ulcers, or regular ulcers, which can be addressed on the camera, as well as if a person has something called irritable bowel syndrome, you can actually see the disease also on the camera. So those are some of our diagnostic modalities that are available to all of us, excluding us in Nigeria as well.
Okay, so after diagnosing it, what are the treatments for few of them?
Yeah, a lot of them can be managed. The one thing I didn't mention about the one GI disease I've not mentioned yet is colorectal cancer, or cancer of the GI tract, which is becoming increasingly more common in Nigeria. I'm seeing more and more patients with it. So if you catch it early, the treatment for that kind of cancer is to have surgery. You remove the areas and rejoin the bowel together. So sometimes the treatment may just be changing of your diet. And there's some things that we can do, which we touched on in the previous question, but I just wanted to be a little bit more precise. What we can do at home to try and avoid some of these diseases. And one of the main things is reducing fatty foods. Fatty and spicy foods will reduce your chance of having ulcers and other GI disturbances, as well as avoiding minerals. That's what they call sodas, cokes, those kind of things. We have to reduce those. Of course, reduce smoking, and as well as increasing your exercise. Your physical movement actually allows your bowels to move more regularly as well. So these are some things that we can all focus on at home to reduce the chance of us having some of these diseases on our own. But if you do have one symptom, it's best to have your doctor check it out.
Yes, you can have your doctor check it out. That's what the doctor has told us. And you can call on 07000 917 or just text us on 070 317 56537 to speak with Dr. Ajayi. This is Doctor, where real doctors advise real people. And Doctor is here for you. You can also reach him on his personal line, which is 091 3579 51008. Let me go again. 091 357 95108. We've been discussing on gastrointestinal diseases, the causes and treatment. You can call him on something else in case yours is not about the gastrointestinal diseases. You do, maybe you're not interested in that, but you're interested in something else to get his words on it. He's here for you. So, doctor, we've spoken about the things that we can take to help us prevent these diseases, because I think prevention sometimes is better. So are there foods? I know you've mentioned some foods that should be taken. You mentioned fiber. You said we should avoid smoking, and so on and so forth. So, but are there foods that should be avoided when diagnosed with gastrointestinal diseases?
Yes, I just barely touched on one of the large diseases, meaning irritable bowel syndrome. And you have some diseases called Crohn's disease, ulcerative colitis. Those are just long terms for types of gastrointestinal diseases that are structural, meaning there may be some change in your GI tract. So for those diseases, oftentimes different types of grains, meaning like wheats, can actually make things worse. So that's something that we can avoid. The other thing that we try to avoid is eating the spicy foods, those that have caffeine, alcohol, excessive amounts of chocolate and or licorice. All those things can increase the amount of stomach acid you have, or increase your chance of getting. So those are some of the main things to avoid. If you notice that I have some patients that tell me, when I eat this food, my stomach always runs. I said, well, then try and avoid that food. Okay, doctor. So it may sound simple, more simple than it is, but
Okay.
avoiding foods that can make things worse for you
Okay.
is on top
You
of
were
the list.
you were talking about spicy foods. Okay, there's a particular tribe in Nigeria that loves spicy foods a lot.
Yes.
They love it. So are you saying that we should practically run away from that, or we can take it once in a while?
Well, the golden rule is moderation in everything, but a lot of people may not know that spicy foods reduce. There's a muscle that tries to protect you from acid, and it's between your esophagus and your stomach. Spicy food actually makes that muscle relax, which is what you don't want, and can cause reflux. So if you know you have heartburn, reflux, or anything like that, you must reduce your spicy food intake, or things can get worse rather quickly.
10 minutes past 10, and it's still radio doctor. Phone is Dr. Abiola Ajayi, the MD CEO of a specialist hospital, and we've been discussing on gastrointestinal diseases, the causes and treatment for it. And it's quite eye-opening that spicy food can cause one of it, because for someone like me, I love spicy food a lot. It's WFM 91.7, women
I have
radio.
a question for you
Okay.
when you have a chance.
Okay, you can go
I
on,
know
sir.
this question is supposed to go the opposite way, right?
Yes, it
But
is.
I want a unbiased. This is our first time talking. The audience may not know that.
Yes.
When I talk about fiber,
Yes.
you as born and raised in Nigeria, what does that mean to you?
Fiber foods.
Hmm.
Okay. Fiber food for me are the likes of lettuce, pear berries,
Okay.
and so on.
How often do you get to eat pears and berries?
Okay, I think I still had berries yesterday.
Oh, wonderful. See, let's have the listening audience try and duplicate what you're doing. Some other items that have a lot of fiber in them, beans, and we do have beans
Yes, we do.
here. We do eat a lot of beans. In the U.S., we talk about berries and avocados. I think we have avocado pear in Nigeria,
Yes, we
as
do.
well as we have different berries. So it's not just sitting down and eating a whole meal of berries. It's incorporating those kind of things in your diet. That's the most important. Green leafy vegetables are efo, ewedu, those kind of things also help in adding fiber, as well as we know they can also help build blood and they have other positive benefits. And you mentioned grains. For example, changing your bread from the traditional white bread to wheat bread increases your almost doubles your fiber intake. So that's a good one.
Thank you.
Nuts
Okay.
like peanuts and ground nuts, and then to ask you potatoes. Potatoes have a lot of fiber.
Potatoes. I like potatoes
Sorry,
a
I know
lot.
you weren't
So,
ready for that quiz. You like potatoes? I do too.
wow. Thanks for that eye opening, Doctor. Thank you very much. It is 19 minutes past 10, and this is Radio Doctor, where real doctors advise real people. And Doctor just advised me on how to increase my fiber intake right now. The numbers to call is 07000 917 or just text us on 070 With me over the phone is Dr. Abiola Ajayi. He is the MD CEO of ROA Specialist Hospital. And you can also reach him on his personal line later, which is 09135795108. And we've been speaking on gastrointestinal diseases, the causes and treatment of it. Now let's talk about it in the with people who have old age, who are aged already, doctor.
Right?
Okay. Now, does it have a different effect on them than those who are young?
Yes, it one of the things one of the things you see with those that are a little bit older is you oftentimes have constipation, meaning they're not stooling at least three times a week. And if you go through the history, you may see medications that can make constipation worse, and you may see medications that can actually make ulcers worse or acid worse. And both of those are GI diseases, as we're discussing today. For example, there are a lot of pain relievers that can cause ulcers or in your abdomen or the upper part of your belly. And there are a lot of pain medications that can also actually cause constipation, as well as supplements. What I see often is I may prescribe medication for my patients. Then if I don't put a blood tonic or some kind of vitamin there, they'll think that something's wrong with me and go and add a blood tonic or vitamin on their own, not knowing that the iron inside can cause constipation. So really, you need all these kind of syrups that we drink, quote unquote blood tonics, these tablets. Most of them have iron, and iron can lead to constipation. So if
Okay.
your blood level is fine, your PCV is fine, you don't really need to be taking vitamin supplements. We only supplement when our diet is deficient.
Okay. Thank you very much, doctor. Good morning. What's your name and where are you calling from? Can Please can you move away from your radio because I can get feedback here.
Okay, I've done that.
Okay. Good morning. What's your name and where are you calling from?
Good morning, please. I want to remain anonymous.
Okay, no problem. Doctor is here for you.
Good morning, doctor.
Good morning.
Please, you said something about pile and femoral. Is it that the
Something about
what we are treating now has effect that it can cause pile or femoral? That's one question there. Another question is that when someone is having this anus and he does not have dysentery, he did not have one, he has never had a hard stooling, and he just noticed that the anus started coming out, no pain, no blood coming out, no dysentery. What can cause that, and what is the treatment?
Dr. Biola, you got that?
He's talking about something protruding from the anus. What is
Yes.
the cause and what is the treatment?
Yes. That was the first question. Also,
Eh, okay.
should she repeat the first question?
I didn't hear it. Yes.
Please repeat, ma'am.
The first question.
Yes.
Oh, my first question is that, like the topic we are treating, does it cause pile or hemorrhoid?
Okay.
Okay, kindly listen over the phone. Dr. Jai, over to you, sir.
Yes. So that's an excellent question from anonymous there. She's asking about piles, and the medical term for pile is hemorrhoid. Pile and hemorrhoid mean exactly the same thing. And like I said before, one of the common mistakes is that we think pile is directly related to sugar intake, which is incorrect. Is related to your fiber intake, which is fiber question earlier. So foods with so she said this person has never had dysentery. Dysentery is related to diarrhea. That's running stomach, and typically those that have hemorrhoids will have the opposite. They'll have constipation. Now, if they don't, she's also mentioned this patient didn't remember having constipation, didn't have hard stools, which is fine. But if they have a diet that had white bread, remember I talked about that white bread before.
Yes, you did.
It makes these things worse. Milk, cheese, and dairy products, meat can also make this work worse. What we're talking about, her topic, hemorrhoids and GI diseases, and the final one, which a lot of us ignore, processed foods and or fast food. So fast food, we know, or what we buy in these eateries, is not the best for your GI system. And then processed foods are, I don't want to name brands, but we have this stick of bread and meat that's like 100 naira or 50 naira, and you know the one I'm talking about.
Yes, I do, sir.
That is a classic for processed food. Those kind of foods, some research show they increase your chance of getting cancer, and we definitely know they can cause GI disease and GI upset, constipation, and the like. So we want to try and limit that as much as possible.
Okay, the second question, where she said
The
she had
second
something
question,
protruding from her anus.
protruding from the anus could be anything to something called anal prolapse. If something's protruding from your anus, your doctor should see it and let you know. Now, just in basics, usually it's a hemorrhoid, and the things that we do, we try and avoid foods that can make it worse. We mentioned this before: white bread, cheese, dairy, fast foods, ice cream, meats, processed foods. Another one, what people buy here often, hot dogs. They call it hot dogs or sausages. Those are processed and can cause a lot of problems in your body. So you try and avoid that and eat diets high in fiber. If you already have a protruding anus, there's something called a sitz bath, which has a special type of salt and hot water. You can sit inside, and that can help dry up hemorrhoids. I do this show for free, so if anybody likes to know more, they can definitely call, and
Yes, you can call on 091 35795108. That is Dr. Abiola Jai's number. So you can reach him anytime, any day. He will definitely reply to you. But then you can call the studio lines right now to speak with him on 07000 or just text us or send a WhatsApp message on 070 It is 27 minutes past 10, and this is Radio Doctor, where real doctors advise real people. We've been discussing on gastrointestinal diseases, the causes and treatment with Dr. Abiola Ajayi, the MD CEO of ROA Specialist Hospital. Doctor, you already told us that people who are aged, they are more exposed to having these gastrointestinal diseases. Can we now talk about children too?
yeah. So just like I said, for the older people, we often run into constipation. For the children, we often run into diarrhea, and for a school age child or a younger child, because of diarrhea in that age, is something called rotavirus. It's a type of virus, and there's even a vaccine for that virus. Other than that, very very small children, I'm talking about less than 3 years old, can get gastrointestinal diseases that can cause their colon to bind on itself or to twist, causes a lot of pain and can cause bleeding. We see that often in after feeding. They may have a abdominal mass or some abdominal pain, and you now go in and find out that the colon has twisted amongst itself, which can be quite serious.
Okay, thank you very much, doctor. Let's talk about the treatment for children. Is it different with adults or the same?
Yeah, it's a completely different because, for please add this to your diet, but for a child, possible.
Hmm.
So it's uh, and oftentimes since a child cannot talk to you and tell you what they're feeling, you have to just go on site. So oftentimes you'll know that a baby has some kind of GI problem or upset just by looking at them. Maybe after feeding, they look uncomfortable. They may bring their knees to their chest, or maybe rolling back and forth. All can maybe signs that baby's having some kind of gastrointestinal upset.
Okay, so as a parent, what kind of is it still food rich in fiber parents should add to their meals so that they can be protected against this disease?
On this show, I'm very careful about advising over the air for children because every child is different, weighs differently, and was brought up differently. So I'll speak very generally.
Okay.
Um, for for children less than 1 year of age, the best thing for them is to be on breast milk. Period.
Mm.
That usually solves all their GI, the gastrointestinal issues once they go on breast milk. But if you're now not able to breastfeed, or maybe the mother's on antibiotics or some other reason, and you're having GI problems, you have to look at the formula. They have different types of formula. They even have formula that reduces baby's chances called alimentary with an A or E, elementary,
Okay.
or low, some of them will call it low immune or immune boost. One of those different names are types of formula that reduce chance of having flare-ups or GI issues.
Okay, thank you very much, Doctor. It is 29 minutes to 11, and the numbers to call is 07000 917 Just text us and send us a WhatsApp message on 07031756537. It is Radio Doctor, your free health consultation program where real doctors advise real people. And with me over the phone is Dr. Biola Ajayi, the MD CEO of ROA Specialist Hospital, and we've been speaking on gastrointestinal diseases, causes, and treatment. Now, doctor, let's talk about when it's not treated quickly, what can it lead to?
The worst thing that gastrointestinal disease can lead to is gastrointestinal cancer.
Hmm.
So some of these diseases can lead to cancer, and of course we know cancer can cut your life short, even abruptly short. And I've been seeing increase of CRC or colorectal cancers in Nigeria, and often it's because our diet is changing. Our diet is moving away from foods that we prepare ourselves and grow ourselves every day to more fast foods and processed foods. And as we continue to do that, we're going to see that cancers and other negative outcomes start to increase.
Okay, so
Whether it is in young people or the older, will increase across the board.
okay, thank you very much, doctor. The numbers to call is 07000 917 I guess some have been trying to call but it's not going through. Kindly call again, 07000 917 or just text us in case the call is not going through on 07031756537. This is Radio Doctor, where real doctors advise real people, and it is 27 minutes to 11 on WFM 91.7. My name is Mojisola Talks, and with me over the phone is Dr. Abiola Ajayi, and then we've been discussing on gastrointestinal diseases. So the causes and the treatment. It's really wonderful to know that good to know that just by adjusting to our diet, and healthy diet, we can get better health. Now, can we talk about exercise, Doctor? Does exercise has a new way of helping to shield or to help in healing this gastrointestinal diseases?
Exercise has a large amount of seen and unseen benefits. So to answer your question simply, yes, exercise can help. You keep mentioning talking about constipation. One of the ways to get things to move is to exercise. And we have research that shows that those that get regular exercise are regular more often, meaning those that get regular exercise are able go to the toilet more than the 3 times a week, closer to 5 to 7 times a week, which has been shown to chance those people that are more regular have less incidence of colon cancer. We're not saying that going to the toilet reduces colon cancer. We're just saying that we've noticed that those that go more regularly have less incidence of colon cancer.
Thank you very much, Doctor. Good. And from
Good morning.
good morning,
Yes, I've not found your own name.
Mojisola.
Hello, good morning. I think this is Grandma.
The reception is not so good, Grandma. Hello.
Good morning. Are you hearing me now?
Okay, yes, I can hear you clearly.
Beautiful, beautiful. So my name is Madam TJ.
Okay.
The topic doctor is discussing is related to pile. Is that not so?
Yes.
All right. Please, I want him to explain once again. They mentioned that those who are suffering from it don't need to eat meat.
Doctor.
Okay.
Mention.
Yes.
And if someone is having it and does surgery, the implication and is worrying the person, is to pain the person, what will the person need to do? That's what I want his answer for.
Okay, Doctor, you got the question.
No, you can help me.
Okay, Grandma, Doctor is not getting the question well. So, can you re-explain?
Okay. I say the topic you are discussing is related with pie.
Yes.
All right. Now, someone who will already have the pie.
Okay.
And he has done surgery.
Okay.
And he's worrying the person.
After the surgery, the pile is still there, worrying the person.
No. The pile have gone. They have removed it.
Okay.
But it's having some discomfort.
Okay.
What does it need to do?
What kind of discomfort?
Pain now.
All over the body.
After surgery, your body will not be the same now.
Okay.
Then the kind of food the person should avoid. Please, if doctor can reiterate it again, I will appreciate.
Okay. Thank you very much. Listen over your radio. Yeah. Yes. Thank you very much, Grandma. Have a great day. Okay, Doctor, should I re-explain what she said?
Yes, please.
Okay, she said someone had pile. I don't know if it's her or someone else, but the person had pile, and the person went for his surgery to have it removed. After that process, the person started feeling pain all over their body.
Okay.
So, and then she said that you should mention the food one should avoid. She said she heard you mention meat. That that she just have another list that she would love to hear again of the food to avoid. But
Very good.
that pile, she just concerned that the pain, is it okay for you to have those pain after the surgery?
Yes, the only thing I didn't get was how long has it been since the surgery, but I'll talk generally.
Okay.
That surgery is extremely painful. I do it often, where you have to actually physically cut out the hemorrhoids or the piles, and of course it's in your anus, which is already very sensitive, so it can be quite painful. shortly after surgery, within a few weeks of surgery, the pain should be gone. I'm not sure of this person's time frame. So if they're still having pain, especially all over the body, which doesn't make sense to me, they should return to where they had the surgery and complain.
Okay.
Now, if I'm talking generally, if I don't know the patient, we talk about some foods that you should avoid, especially if you do not, because if you had surgery, you can actually get piles again. They can regrow. So some foods to avoid, to make sure you include in your diet to try and reduce the chances. So I'll run through the list quickly again. One of them was dairy products, meaning like cheese, milk, and so forth. Other things, fried and fatty foods. We also try to avoid that as much as possible. Foods that are acidic. And when I have a patient that has an ulcer, and they're asking me what foods to eat we have a nutritionist that advises them, but I give them a basic rule. The basic rule is if it's something that you wouldn't touch to your face or your eye, then you should try and avoid it, especially if you have ulcer or GI upset. For example, let's play a game. Would you touch cucumber? Would you touch it to your eye? Would you, Sola?
No, I wouldn't.
A cucumber. Can you put cucumber?
Okay, I can put,
Cucumber.
definitely. I can.
Yes. Let me pronounce it as I'm Nigerian born. So yes.
Cucumber.
And cucumber. So you can put those on your eye. That's something safe to eat if you have an ulcer. Now, would you take a orange slice and put that on your eye, or a lemon slice and put that on your eye?
Oh, lemon would be painful.
Will be extremely painful.
Yes,
and that's how it's painful for your stomach. Same way. So when you're young or you don't have any issue, you can eat anything. We're talking about age now, but as we get older, we have to try and reduce these, especially if we've had symptoms in the past. We know what's fatty foods. Those are fried and dipped in oil and or butter, and they're typically low. Another on our list, we talked about processed foods. Very, very little fiber. And processed foods are usually packaged foods. They're foods that are packaged so that they have a long shelf life. Okay, they typically have preservatives. For example, the item that we were talking about that's sold in traffic up and down, you can take that and leave it on your shelf for a year. Right? You can even leave it on your shelf for 2 years. Come back and eat it. Something should make you worried about something that you can leave on the shelf for 2 years and eat. When your mom cooks food, or you can't leave that food out for very long, or it spoils.
No, it's
right?
spoil. Yes.
Yeah, there's a reason, because it's natural, it's fresh. Bacteria want to work on it. When you have something that doesn't degrade over a year or 2 years, imagine what happens in your body. Your body also make it very difficult to degrade. So that's what I mean by processed or packaged foods. And then we also try and avoid caffeine. And caffeine can also increase your stomach acids. And like Grandma mentioned, meats, especially red meats, can cause constipation and can cause other types of gastrointestinal diseases. It's been linked to different types of cancer. And red meat has also been linked to prostate cancer as well. So those are things to definitely avoid.
Okay, you can call us on 07000 917 917, or just text us with any question you have for Dr. Abiola Ajayi, the MD CEO of ROA Specialist Hospital. You can text us on 070 317 56537, and then his personal number is 09135795108. Let me go again. 09135795108. It is 18 minutes to 11, and it's still Radio Doctor. We are real doctors, advise real people, and we've been talking about gastrointestinal diseases, causes, and treatment. Doctor, you've told us about how we can avoid so many things, and the things to eat. And I remember the last question I asked you before we had the call was exercises. You said exercises has been known to help a lot of people. Now, are there people who have a particular disease? Okay, should I frame this? Okay, let me frame it like this: that are there people who are more prone to have gastrointestinal diseases, like a particular set of people?
Yes, they're different for the different diseases. There are, for example, we talked about the elderly, and I talked about constipation, right?
Yes.
Constipation can lead to another thing, which I see often in my practice, called diverticulosis or diverticular disease, and it's basically where your bowel or your colon has been stretched, and you have to further make your constipation worse. And when I talk about it's common, at least 10% of those 50 and above will have this disease, and the symptom would be constipation. Sometimes they may talk about bleeding and bloating, but it can, if not treated, it can actually lead to a rupture of your colon, and even worse down the road. So that's one of them that affects the elderly. And we talk about diarrhea and viral infections that can affect school age and younger children as well.
Okay. And if the symptoms, if the return, said it and it's gone, let's say constipation, it's gone.
Yeah, the for is different for different people. If it's if you treated colorectal cancer or cancer and you have any of the symptoms return, you need to go back to your physician. If you had surgery, you need to go back to where you had surgery and complain. There's always a chance that cancer can regrow, or there's a chance that when you may not have removed all of it. So you should be in close contact with your medical team.
Okay, and just in case you want to get in close contact with Dr. Abiola Ajayi, the MD CEO ROA Specialist Hospital, you can do that on 091 3579 5108. 091 3579 5108. And today we've been discussing on gastrointestinal diseases, the causes and the treatment over the phone. It is 15 minutes to 11, and in some few minutes time we'll be out of here. This is Radio Doctor, where real doctors advise real people on WFM 91.7. You can call right now to speak with Dr. Abiola Ajayi on 070917917, or just text and send a WhatsApp message on 07031756537. So, Doctor, I really want you to answer this question so that we can take.
Sure.
Doctor? Okay.
Yes, go ahead.
Okay. So, I really want you to answer this question before we receive another call or get a text message. Now, you spoke about vomiting blood. Did you? I think you mentioned that something that has to do with blood.
Yes, I did.
Okay, yes. Now, I know you mentioned that for different gastrointestinal diseases, there are different treatments for it. So I really want us to
Right.
focus on that, because when people vomit blood, there's a different kind of feeling. Will you say that when you start vomiting blood, that is really a gastrointestinal disease, or it's something else?
Vomiting blood is a sign of something else. Is a sign of something, right? So that could be anywhere from, it could be anywhere from an infection in the GI tract that's causing you to throw up, and then when you keep throwing up repeatedly, you now have bleeding, a ulcer, or an erosion in the upper GI tract. So any of those, depending on the diagnosis. So with this your patient, they're just vomiting blood. Of course, we want to bring them in, give them fluids to replace the blood, but we
They've
also want to
lost.
find out what. Yeah, so if somebody's vomiting blood or vomiting period, you need to replace those fluids.
Hmm.
So we connect them to an IV and replace the fluids, but also the electrolytes. When you're vomiting, you're losing potassium, you're losing some of the minerals, and it can throw off your general body balance. So we try and bring that back into balance. The second thing is diagnosing. You have to know what is causing the bleeding, because there's so many different causes. If you start heading down the treatment path of one cause and you've made a mistake in your diagnosis, you may end up making the patient worse or not helping the patient
Hmm.
at all. So the diagnostic part is extremely important. Usually, that somebody coming in bleeding like that, you try to make them bleeding, and then you now may order a test. We have different types of tests to look at your GI tract. One of the most simple ones is an X-ray. You can do X-ray of the belly and of the chest, looking for different signs. Another one is something called EGD, where you take a camera, put the camera down the throat, and of course it's sedated in the theater, and go all the way down. You can even go all the way to into the colon, looking for any abnormalities on the camera screen. And if you have something like bleeding, you can actually use stop the bleeding on the camera. So that's
Hmm.
something that can be diagnosed and treated at the same time.
Okay.
And if it's any of the other ones, we take them diagnosis and then treatment.
Okay. Thank you very much, Doctor. It is 11 minutes to 1, and this is Radio Doctor, where real doctors advise real people. The numbers to call is 07000 917 so you can speak with the doctor. Hello, good morning. What's your name and where are you calling from?
Yeah, good morning. My name is Mike. I'm calling from Mowe.
Okay, Mr. Mike, doctor is here for you.
Yes. Generally, what can stomach and then stools dented with bloody stool.
Okay.
Yes.
Okay, doctor, you heard that. You
Now,
said okay.
yeah, is that the same patient?
Is it the same? No, this is a different person.
No, I'm saying
The same person,
the
yes.
person
Yes,
with
the
the
same person.
Okay, the same.
are they also
Yes.
having? Yeah, you said they have a belly that's large and what else? And bloody stool.
Yes, bloody stool.
Yes.
Okay.
Yes, over to you, doctor.
Okay. I'll answer the question. Normally, I ask them to hang up so they can listen.
Okay.
So when you talk about abdominal swelling, or he said protruding belly, but that's what we call abdominal distension. There are a few different causes. Some of them can just be because we're obese or overweight. That's where we keep a lot of fat. But according to this, on the line of this discussion, we're talking about irritable bowel syndrome. We touched on it briefly, and that person may have a lot of gas and or reflux, and with the belly, with the abdominal distension. Somebody with irritable bowel syndrome usually has a type of food or a group of foods that make things worse. And by worse, it can make the belly swelling worse. They can also have bleeding from the rectum. This kind of patient that he mentioned needs to be seen by a doctor.
Hmm.
What I do for WFM, we have a mission Hope Medical NGO, and some of these people, they're having difficulty finding good doctors or paying for medical care. We take one or two people a month and take care of their treatment. So if somebody wants to ask about that, we do it on a case by case basis. They should just call me personally.
Okay, and
But
you can
for this,
okay,
go ahead.
and you can
What I'm
call
trying to
him
do.
on. I just
Yes,
want to say
go
your
ahead.
number so that okay, you can call him on 091 3579 5108. Over to you. Continue, doctor.
Yeah, what I was just trying to stress is that somebody bleeding or have rectal bleeding or bleeding from the anus, that's an emergency. Okay,
Hmm.
so it's not something for us to really be discussing casually on the radio. That's an emergency. So I stress that this attention quickly, whether it's with me or anyone, just make sure you seek medical attention quickly. So
Okay.
in general, I'm talking that person may have irritable bowel syndrome, and once we see, then we can now diagnose them properly.
Okay, this is from Justina Atakute. She said, hello, Dr. Ajayi. I had rectal prolapse during labor while pushing, and it's been 4 years. I heard it goes on its own, but it's still there. Sometimes it's painful after bowel movement. What should I do?
Well, she's correct. It does sometimes go on its own, but after 4 years, 4 years is far too long. Normally, we talk about 6 months for it to go. So something that's been there for 4 years, it may be an issue. I would ask her, has she done any of the medical treatments? And when we talk about medical treatments, that's taking bulking agents, things that have fiber. You can take that through the diet. You can also take fiber supplements. Then we use stool softeners, and have so many different agents. So I like to see what she was using, and if they've tried all the medical treatment for a long period of time, we can also do something called biofeedback, where you try and teach the patient how to do some exercises that can actually strengthen the muscles that hold the. And if all of those fail, then we end up doing surgery. We can do surgery. It's called Rectopexy, where you actually can stitch the rectum back in place. So this can be, they can always be corrected. So you try the medical treatment, and then if that's not successful, you go to surgery. But 4 years is for her to have been suffering with this.
Okay. I hope Justina heard that over our radio. Oh, thank you very much, doctor. So we take this last call and that will be it for the day. Hello, good morning. What's your name and where are you calling from?
Good morning.
Good morning.
I'm coming from Ogba. My name is Victoria.
Okay. Doctor is here for you.
I'm having this fibroid. It has been gone before. I went to care hospital. So I just sleep and pray. But later now, I'm feeling pain in my abdomen. Then I went to my son and we go to lab. He said it's fibroid again. So I wonder, what am I going to do? It's making my tummy swell. There's especially the pain. So what am I going to do? And now there's no money to do anything. I'm confused.
Okay, doctor.
How old are you?
Doctor asked how old are you?
I'm just class 63 by the grace of God March.
She's 63 years old.
63. Okay. And have you ever had surgery before?
Yes. Have you said
surgery before?
Doctor asked if you've ever had surgery.
The fibroid?
Yes.
Well, that one time, that was long time. I thought it had gone. So the thing was paining me again. I went to see my son, then he went to lab. That's how they said it's fibroid again. I said, what kind of problem is this?
I get it.
Okay, kindly listen over your radio. Yes, over to you, Dr. Ajay.
Yeah, so she's a 60-year plus female that had surgery for fibroid a while, some time ago. Sounds like, over 5 years, maybe over 10 years ago. And now she had new onset belly swelling and learned that her fibroid came back. And she asked simply, what is this? And the simple answer is that fibroids regrow. So typically what I do, if I have somebody that has had their children or close to menopause, we typically advise them, instead of removing the fibroid, remove the womb entirely, because fibroids regrow. It's not whether or not will they regrow, it's when they will regrow. And just because you're in menopause, oftentimes that usually solves the problem if they've not done surgery by then, but it's not guaranteed. And as you get older, the chance of you having cancer of the uterus or of the tract leading up to. So,
okay.
We try and remove the womb if indicated.
Okay.
So for her, it's classic. They will grow back. It's just a matter of when.
Okay.
So for her, if it's bothering her, belly swelling, this and that, she needs a surgical intervention.
Okay.
This is the kind of people we try and help. So she should try and make contact later.
Okay, thank you very much, doctor. So what would be your last just something to summarize this discussion? Our time is fast spent.
Yes, quickly the main thing, because all of us, you mentioned something that all of us are going through nowadays: lack of money, because of what's going on in the world. And so I just stress that one naira you spend today on prevention will save you 10 on the cure. And some of those prevention things, just buying more fruits and vegetables that has fiber. And when somebody says an apple a day away, that may not be true in terms of specifically, but those that increase fiber and increase fruits and vegetables can definitely reduce their doctor visits.
Okay.
With that, I'll say have a good week ahead.
And you too, doctor. You can contact Dr. Abiola Ajayi on 09135795108. Thank you very much, Doctor. Bye-bye.
My pleasure. Thank
Okay, so that was Dr. Abiola Ajayi. Is the MD CEO of ROA Hospital here in Arepo. You can reach him, like I said earlier, on 09135795108. And thank you for your calls and contributions. Radio Doctor is Nigeria's first free consultation specialized radio health program on WFM 91.7. We broadcast Monday through Saturdays from 10 a.m. to 11 a.m. Each day is dedicated to a medical specialty with an expert to offer free consultation and advice. Tomorrow, Saturday, is teenage health. To join the discussion, you can send your question to our social media platforms: Facebook WFM 91.7 and Twitter at WFM 917. Or just log on to our website www.wfm917.com. A very big thank you to my production team in person of Esther Alaribe and Daniel Adaja. My name is Moji Salah Talks, and I wish you a healthy day.
To sponsor this program, please call 080-9058-2769.
Mo ń bá aláwìyé mo fẹ́ tara dé báǹkì wọn ó gbà lónìí.
Ṣé o wá sí?
Lórí pé mo fowó ránṣẹ́ sọ́mọ mi. Báǹkì wájú odidi $50 50 Wọ́n wá wí pé owó stamp duty. Ṣé mo wá kọ̀wé ránṣẹ́ ni?
Hábà stamp duty ò bówó ìfìwé ránṣẹ́ tán. Kódà kò jọra wọn. Stamp duty lówó tíjọba pa àwọn báǹkì láṣẹ pé kí wọ́n máa já. Nígbà tí èèyàn bá fowó tó tẹ́gbẹ̀rún 10 tàbí jù bẹ́ẹ̀ lọ ránṣẹ́ látàsùnwọ̀n ìfowópamọ́ kan sí mi. Kódà wọn á tún máa gba stamp duty lórí ìwé àdéhùn láàrin ọlọ́dani sọ́lọ́dani tàbí ilé iṣẹ́ sílé iṣẹ́. Owó yìí ní jẹ́ kírú ìwé àdéhùn bẹ́ẹ̀ ó gbòǹtẹ̀ òfin. Ọ̀kan pàtàkì ní stamp duty jẹ́ lára owó orí tó pọn dandan ní sísan gẹ́gẹ́ bí ọmọ orílẹ̀-èdè rere. Torówó iná níjọba ń rejọ láti gbọ́ bùkátà ìpèsè ohun amáyédẹrùn bíi